Hi everyone, Dr. Jim Condrop here. I'd like to spend some time with you to discuss how to deal with the pain from endometriosis during the COVID-19 pandemic. For those of you who don't know me, for the last 32 years I've dedicated my career to do minimally invasive gynecological surgery. I've treated patients with endometriosis during all of those years. In addition, I've traveled to around 30 countries around the world where I've done surgery or did lectures or educated surgeons, residents, nurses, scrub teams on how to do laparoscopic surgery, including endometriosis surgery. So what I'd like to do is share with you some of my thoughts on how to get through this pandemic until you can get definitive surgery. So let's talk about endometriosis. So endometriosis basically, I tell everyone, has three characteristics. First of all, endometriosis is inflammatory. And that's what causes a great deal of the pain. And a lot of our treatments are geared towards treating the inflammation caused by endometriosis. And some of the medications we use are geared toward that also. Endometriosis needs estrogen to survive. So a lot of the treatments that your healthcare providers will give you will be targeted at the estrogen levels also to try and reduce those estrogen levels. That has other side effects. The second thing is endometriosis is invasive. And that's why a lot of us surgeons are excision surgeons. I've always been an excision surgeon, and a lot of my videos show surgeons how to do that. So endometriosis can invade nerve fibers, ligaments, the bowel, the bladder, and different organs, and that causes a great deal of pain. And endometriosis is not curable. You can manage endometriosis to a level where your pain is manageable or possibly your pain is gone. But it's difficult now, especially since all of the elective surgeries have been canceled over all of the states and around the world also, because we only have a limited amount of equipment that we can use, protective equipment, and especially patients in the operating room, when they come in, we have to use extra equipment to protect the healthcare staff. So a lot of the elective surgeries are being canceled. The only surgery we're allowed to do would be that of emergent surgeries. So let's talk about some of the different things that you can do. So medically is the only way we can really treat you at this point. We can't do surgery until the pandemic's over. And let's talk about non-steroidal anti-inflammatories. Well, if a woman can take anti-inflammatory medications, that's good. Some women cannot take anti-inflammatory medications. Maybe they have a bleeding disorder, or they have a problem with an ulcer or something like that. So one of the common things we use is ibuprofen, naproxen, and a lot of us use longer-acting medications like diclofenac is a generic name, and we'll do that. And sometimes we'll use something called Ponstel. We used to use Celebrex, Vioxx, Bextra. Those are all good anti-inflammatories. The thing is, you have to be careful that you don't take too much of that because it does go through the kidney, and also you want to make sure that your stomach isn't irritated, especially if you're on prednisone, which is a steroid, and these anti-inflammatories. Now, the key thing about anti-inflammatories and endometriosis is you have to take it properly, and most women underdose themselves. And if you're just having pain with your menses, and don't forget there are 3 different types of pain associated with endometriosis most commonly. Number 1 is dysmenorrhea or painful menses. Number 2 is non-menstrual pelvic pain, and a lot of people don't know that, and that's the pain that women get in between their cycles. It's the pain they get not when they're having their menses. And healthcare providers sometimes have difficulty dealing with that because they don't know if the patient is seeking medications or the pain's not real. So non-menstrual pelvic pain. And the third one is dyspareunia if you're sexually active. So with dysmenorrhea, it's very important that you remember that non-steroidal NSAIDs, we call them, anti-inflammatories, like Motrin, ibuprofen, etc., those are pain preventers. They're not painkillers. Only narcotics are painkillers. So it's important that you take these medicines before the pain occurs. So what I tell patients who have regular cycles and know when they're going to get their menses is to dose up really well before the actual menses starts, just when you feel the onset of the cramps. So for example, if I'm using a medicine called diclofenac, for example, the patients will take 2 tablets immediately when they feel the pain coming on, and then 1 every 8 hours after that. If you're using ibuprofen, you want to take 600 to 800 milligrams right away, And then you can take that every 6 hours, and you can take acetaminophen in between that. Now let's talk about other medicines. A lot of women are given birth control pills. They're also called BCPs or OCPs, oral contraceptive pills. And the reason you're given that is because we know that when you combine estrogen and progesterone together in that small pill, it'll suppress the ovarian function, but also the combination of the two will thin out the lining of the uterus, the endometrium, and hopefully thin out the endometriosis. Now, the birth control pills don't treat endometriosis or cure endometriosis, but it will help with the amount of bleeding you're doing sometimes, and also if I can get rid of your periods for a period of time, then you'll feel better. So in other words, if a woman gets a period every month and she has horrible pain every month, if I can get rid of 2 or 3 of those periods and only give you 3 or 4 menses a year, then you'll be much happier. And that's called continuous therapy. In other words, you don't take the 7 days of the placebo pills and then you won't get a period. Some people can do that. Some people have issues with bleeding during that time where you're trying to continue on in the pack. So birth control pills are very common. Of course, if you're over 35 years smoke, you can't take that. If you have a history of blood clot or something like that, you can't take that either. So that's important to know. And some people just can't tolerate birth control pills, but there's a birth control patch. And there's also the NuvaRing that goes in the vagina, and they're all as effective in helping to decrease the pain from endometriosis. So that's an option. Then there's a progesterone-only pill. Now, progesterone is widely used. Different parts of the country or the world use different amounts of progesterone. And most common progesterone that's used is norethindrone. The brand name for that is Agestin, but mostly we talk generics these days. And the progesterone-only pill has a low dose of norethindrone. But most of the clinicians that I meet use a higher dose. They use around 2.5 to 5 milligrams a day. And that's a pretty well-tolerated medicine. Some side effects can include headaches, some bloating, things like that. But generally pretty safe and doesn't always work, but it's something that you can add to other therapies also. And then there's Depo-Provera. Now, Depo-Provera is an injection. And when you get the Depo-Provera, that's in your body for 3 months. So how does that work? Well, the Depo-Provera cuts out your menses. And you can lose your menses if you take the injection every 3 months for years. And we used to be concerned about bone loss with Depo-Provera, but really not much anymore. So that's an option for you. Now you move on to the much stronger medications. And the much stronger medications are really geared towards cutting your estrogen level down. And I'll give you 2 of the common medicines that are out there. Depends on where you are in the world. They have different names. So Leuprolide is known as Lupron, but these are medicines, and you can take that in an inhaler, a pellet, an injection. Most commonly, I'll use it. When I do use it, I'll use Lupron every month. There is a 3-month dose, but I don't like to do that because if the patient's having some side effects, I don't want to keep her on there for 3 months' time. So, but I can give her every month. Now, what Lupron does is it goes to the brain center, and it goes to the area in the brain that regulates how much FSH is delivered. And FSH is the hormone that stimulates your ovary. And when it stimulates the ovary, it stimulates estrogen. So the goal is to drop your estrogen. And this medicine is like hitting a nail with a hammer. It's very strong. So it just wipes out your estrogen. But you get other side effects with that. Headaches, mood swings, very rare chance of blood clots, and some people just can't tolerate that medicine. And we tend to give you medicine back with that. We'll give you progesterone while you're taking that medicine, or give you a little bit of estrogen to try to bring that up. So it can be quite effective, but it does have its side effects. Don't forget now, we're talking getting you through this situation until you can get surgery. And I'll discuss that in a few more minutes. The next medicine is Orilissa. Now, Orilissa is an oral medication. It's not really like Lupron. So if you couldn't tolerate Lupron, doesn't mean you're not going to tolerate Orilissa. Now, Orilissa is pretty new out there. It's been out there for a little over a year. And what Orilissa does, it's an oral form that you can take to decrease your estrogen. And you can take it once a day or twice a day. And of course, the more you take, the lower your estrogen. So you can actually adjust that. It's quick to work. And you don't see pain relief for around, maybe 3 weeks to a month and a half. Everybody's very different. But if you can't tolerate the medicine, stop it. And it's out of your system in 24 hours. So Orilissa's out there at different dosages. And that might get you through what you need to do to survive, to get through this difficult time. Now let's talk about some alternative options. Of course, alternative medicine is always out there. There's acupuncture, there's yoga, there's meditation. And basically, there's other things like legal marijuana There's some studies about using marijuana for pain from endometriosis, and there was a pretty good study in one of the journals recently on that. There's CBD oil. You have to get good quality CBD oil if you're going to use that. And some of my patients have used castor oil. And it's a little thing that I learned from my patients and some of the urogynecologists. So what you do is you get a piece of flannel. And why this works, I don't know. But castor oil comes from the castor plant. So you get a piece of flannel and you soak this flannel in the castor oil. And then you put it on the area of your body that's in pain. Maybe it's your suprapubic area just above your pubic bone, down in your pelvis. And then what you do is you get one of those bean bag or rice bag things that you use, you put on your neck or something like that. It's like a heating pad thing. And you put it in a microwave. And don't make it too hot, but then you put it on top of the flannel so the heat and the castor oil goes down into that area. And I have patients that swear by that from fibromyalgia, etc. So that can be very, very helpful. So these are some of the medical options that you can use until you can get surgery. Now let's talk about surgery. Well, I guarantee you there's going to be a backlog because there's going to be orthopedic surgeons that have been waiting to get in and do their ankle surgeries, their knees, their hip surgeries, all the things that have been put on hold, and hernia surgeries and other GYN surgeries. And so there's going to be a waiting list who can get in. The other sad aspect is who will have health insurance. And we don't know how many patients who had health insurance will no longer have health insurance. And then the question is, will your surgeon take that insurance? Now, a lot of people have been saving. I see all things on the internet. People have been using their savings to save up to go to some of the endometriosis centers that just take cash. And that can be anywhere from $5,000 to $10,000 to $30,000. And unfortunately, with the pandemic, a lot of people are going through their savings if they've been furloughed. So it's really hard to do that, to get into a center where you are going to go. And so you have to shop around, and you have to find a surgeon that does endometriosis surgery. You'd hate to spend money on going to have surgery with a surgeon that's not familiar with how to do endometriosis surgery. That's a whole nother lecture in its own of which surgeons, how can you find an endometriosis surgeon, why don't surgeons all treat endometriosis, what are the roadblocks for surgeons, and access. So I'd like to let you know that you're not alone. And we're doing a lot of telehealth. I had two patients with endometriosis. I've never met them before. We did an entire new visit over telehealth. The good news is that the government has said that your insurance companies have to pay for that. And your insurance companies will pay for that visit just as if you're sitting in front of me. The difficulty is I can't give you narcotics because we don't want to do narcotics. So I didn't mention narcotics in there, but if you're going to do narcotics, you should definitely be doing that with a pain clinic, a pain center that can help you through that. You don't want to become addicted to that. So with the way it is now, before the COVID-19 pandemic, it was difficult for women to gain access to good surgeons anyway. Now it's even worse. And now the roadblock may be a backlog of surgeries, your lack of funds, and also possibly the fact that you don't have health insurance after this. So I wish you luck. We do some telehealth consultations. Like I said, I've treated people medically already from different areas, and I do have a website. It's www.lapexcel.com, lapexcel.com. You go to YouTube, put my name, Kondrup, Kondrup, and I have videos there. I'm trying desperately to get more videos up on the YouTube. People keep asking me for more videos, especially endometriosis videos, and the challenge is that I was working all those hours, and it's hard to do that. I don't have any production team. And also our phone number is 941-207-5330. And I'm in Florida now. I moved down from New York, and I apologize for not being more available. But of course, you have to get a team. You have to get your operating room equipment, and you don't want to start doing anything extensive until you have that in place. And we have that now. So we've been here a little over a year now. So anyway, good luck to you all. I wish you the best of luck. Be your own best advocate. You must search around. You must look and take nothing for granted and educate yourself. And there are great websites that you can go to, chat rooms that have great education on endometriosis. And I wish you luck. And if there's anything I can do to help you, please feel free to reach out and contact me. And thank you.